Welcome to Fresh Outlook, where we talk about the most talked about topics. I'm Toschi. This week, we're discussing Obamacare. The president defended his health care act this week, but Republicans are firing back. Next, we'll jump into New York's political arena. Anthony Weiner says he's not going anywhere despite new reports of more online escapades. We'll also have a discussion about New Jersey's Governor Chris Christie. If the polls are right, Christie is in a top position to seek the presidency in 2016. Does he stand a chance? And last but certainly not least, a prince is born. We'll talk about the media frenzy and what his royal birth means for the British monarchy. But first, let's talk about Obamacare. The president defended his health care act this week, saying tens of millions of people will have new benefits like free checkups and cheaper medicine. But Republicans say not so fast. The president is throwing more money at a bad idea. Let's take a look at the latest news.
There are around 44 million Americans who are currently unable to get health insurance. Not surprisingly, people with lower incomes are more likely to be uninsured. Obama's health care reform law aims to extend health insurance coverage to a large portion of the uninsured. Despite media coverage on the act, many Americans suffer from a lack of knowledge about the law and its implications for them. According to the Congressional Budget Office, health care reform will reduce the number of uninsured people by 27 million by 2023. Many critics are placing the blame on states for not spreading the word. Republicans, on the other hand, claim that Obamacare falls short, but Obama's administration continues to push through, publicizing how the American public will benefit from this health care reform plan.
And we want to welcome our first panel to discuss Obamacare. Joining us is political analyst Dee Dee Benkie, media analyst Jackie Guzda, and political psychologist Dr. Bart Rossi. Welcome to the show, and thanks for sharing your insights with us today. I like that one point where we heard in that story right there that Americans lack knowledge. So I want to clear one thing up. Obamacare is the same as health care reform. The official name, of course, is the Affordable Care Act, a bill that was signed into law to reform the health care industry. And I don't even think that most Americans really know all the facts about this. But one fact right here, 60% of all bankruptcies are related to some sort of health care crisis. So is Obamacare a good solution? Dee Dee, I'm going to start off with you.
Well, I think it's a total disaster, and I'm really hoping that Republicans will somehow push it back. And Obama himself is pushing back to 2015, the employee mandate, because it's so unpopular. Nobody wants to have to deal with it, and he doesn't want to have to deal with it before the midterm elections because the Democrats are going crazy saying this is going to hurt us. You've got to push it back. So already it's a problem politically, and of course it's terrible policy.
Okay, we're going to get back to you. I'm pretty sure I know where you stand there, Dee Dee. All right, Jackie, share your thoughts on this.
Look, I don't even see it as a Republican versus Democratic issue. I see it as a big business versus the rest of us issue. The reason that you haven't heard that much about Obamacare is that the right has been putting so much money into a negative campaign against Obamacare. They've spent $250 million to come out against it, as opposed to the $76 million that Obamacare has sent out trying to support it. That's 3 to 1. It's the media message, and that's why so many Democrats now are saying we're not in favor of this.
Well, Dee Dee and Jackie, we're going to get back to this in just a second, but Dr. Bart Rossi, I want to ask you, because you deal with submitting claims to health insurance companies, how do you think this is going to affect your practice?
Well, my practice actually does almost 4,000 claims a month, okay? Most of it Medicare because we provide services in long-term care. When we have insurance companies, they do this. They don't want to pay us, they find ways not to pay us, and they don't deliver services to needy people. Under Medicare, I get paid on every single session that I do. Big difference. I'm in favor of the Affordable Care Act. I'm on the other side of where Dee Dee is. I think in the long run it's going to be very effective. It will cover people who have zero insurance. They're going to the emergency room now and costing us more money.
Well, I'm going to go back to the people who have zero insurance. A lot of folks, and I'm sure, Dee Dee, you're going to agree on this one, say that, why am I going to pay for somebody and that's going to cost me more money. So, Dee Dee, I'm going to ask you your thoughts on that.
I don't think Americans should be forced to do anything by the government, not like this. I mean, obviously, with health care, I don't want to be told I have to do this. And also, how about this little fact? That the IRS, they're the ones that are going to help enforce this. I mean, these are the line dancing, Star Trek watching video people. I mean, they're not able to get anything done right. So it's just a total cluster. This is not good. And the Obama administration, again, they know this now, which is why they're pushing back, because it's so unpopular. And people don't understand it because it's difficult to understand. Reading through the facts, it's like, wow, how's this going to work? I don't think anyone knows how it's going to work, but I don't think it's going to be good.
Yeah, I'm on the other side of that, because I say that if someone's 35 years old and they have a job, but they don't want to get health insurance, when they drive their Corvette into a tree, we're going to pay for them. That person's going to the emergency room and millions of dollars in claims to the hospital. We're going to pay for that.
You know, a lot of doctors are against this, though, because you seem to like it, but many doctors are like, forget it, I'm getting out of the medical field.
The American Medical Association, the American Psychiatric Association, the American Psychological Association, and the American Mental Health Association, all for Obamacare.
No, I'm telling you.
Let me go cite a new poll from the National Journal. Majority don't want to repeal. 36% repeal, 30% of Americans say wait and see, and 27% say that this program needs more funding. So, Jackie, I'm going to ask you your thoughts on this and where you stand on all this.
I think it's an absolute crime that 16% of the people in the United States do not have health insurance. How can we say that we're one of the greatest countries or the greatest country in the world when that many people do not have access to a basic right? And the reason, Dee Dee, that all this confusion is going on is because of big business. What is going on is that 97% of the businesses will benefit from Obamacare. Only 3% are going to be paying more. Now, they're paying more for that other 97%, and that's why they're upset. They'd rather put millions into an anti-campaign right now to confuse the people than to spend billions later.
Well, they're doing it because they don't believe in the program. That's why they're doing it.
No, it's not.
Yes, it is.
Big
we don't want the
business
program.
Does not ride on belief. They ride on money.
Business and many Americans are like, what in the world is this all about? No one does understand it. It's confusing
because of the media campaign that they've been running.
It's difficult to read through. It's like a stack this tall. I mean, this was ramrodded through when it happened and barely
ramrodded.
Oh,
it's gone through Congress. Congress tried to push back on this, Republican Congress,
and
40 times.
Yeah, we're going to try to repeal it. We're not done yet.
When it was approved by the Supreme Court, they didn't accept that either.
Well, let's just say that I think we all agree that there might be a problem in the system right now. We're seeing enormous costs. We're seeing at least 60% of all bankruptcies are because of healthcare related costs. So something is clearly wrong.
And usually because insurance companies will not cover for an illness. And Obamacare is trying to resolve that problem. And what Dee Dee is saying might make sense from the extreme right when you're really trying to oppose anything Obama wants to do. But practically, I think it's going to work.
Let me ask you a different question to Dee Dee's point. What about being told what to do? Hey, you don't do this. Big government says,
Great question.
You don't do this, you're going to get penalized.
I drove a car over here today. I had to get insurance on the car. I had to have a registration. We need to have people covered by insurance.
But you don't have to have a car. Guess what? Nobody has a choice in this matter. You have a car, fine, but you don't have to. You can ride your bike and do whatever you want. With Obamacare, we have no choice. It's crazy.
You need health insurance.
Sorry,
if
I don't have health insurance, we can't.
Okay, Jackie.
Thank you.
What the meat of the issue?
The meat of the issue is that the money behind this smear campaign against Obamacare comes not from the individual business person, who will benefit from this, by the way, but from the Koch brothers and their millions, from Karl Rove's GPS Crossroads. Those are the ones that are trying to take it down. Why? To get their way. And you know what? I find that extremely...
Because they believe in it.
It's not belief, it's money. It is business.
I don't know what you're talking about, Jackie. Of course we don't believe
I
it.
know you don't.
Let's talk about what Republican Marco Rubio said. He also came out and said that it requires more spending. It also requires a bigger role in government. And he's saying that it's throwing more money into a bad idea.
He's wrong. And
no, he's right.
He's wrong in a lot of ways because...
But what about paying for individuals who don't have insurance?
Well, how much money is it costing us with insurance companies competing against each other when they're controlling the whole
competition.
world? Competition, there is no competition with health insurance companies. They control it. It's like socialism with insurance companies. It's not socialism with the government. They're controlling us. They're not paying for the doctors, and they're not paying for the service to the patient. That's what it's trying to solve.
Jackie, I see you jumping in there.
I am. Look, the premiums will go lower for people who are at risk. Young, healthy people, their premiums will rise. Now, the thing is that they will get tax credits and tax breaks to cover that loss of money. And a little bit more comes in from that 3% from the top. Obama has said again and again he's going to shave a little money from the top where they have it in excess, and they're going to give it to the middle class. That's the way this thing's going to work. I mean, if you're saying this whole big thing is going to blow up in our face, premiums are going to skyrocket, all of the above, well, you know what? Then why the big pushback from the Republicans? Let it go into effect.
Because we don't believe in socialized medicine.
Let it happen.
We don't want it.
if you
That's
don't
why
bel-
the Canadians come over, because we have good health care and they don't. It's going to be a disaster. Not only that, all these employers, you think it's good for business, it's bad, because they're going to all these part-time workers because it's cheaper for them. They're getting rid of jobs, so it's hurting the economy as well.
We spend so much money in this country on health care. It's outrageous what we spend. The Canadians, don't spend that much per capita like we do.
Get ready to spend more with this.
We
Hopefully
spend
we
a
repeal it.
fortune on it. And this program is going to work, and that's why the Republicans don't like it. They want to get it off center stage now because they're afraid it's going to work. I think it will.
no
And
way.
I do think this is it
We
is
definitely
a
don't think
divisive
that.
issue. I mean, there's no doubt about that. But I do think that the Republicans clearly see this as one of the most pressing economic threats to the U.S. right now. So I'm not so sure if I think that everybody is very passionate about their sides. I'm not sure. I can't really go with the side that the Republicans are just blasting it because
They don't like Obama. We don't care. We care about the health care.
Well, they're linking it to the government controlling us.
Yes, of course.
And I say
that's what we believe in. No, less government. That's why we don't like it.
If you want less socialism, take a look at the insurance companies. They control us and they don't pay.
Well,
so that's
let's-
socialism to
Sorry,
me.
it's not.
The year is flying by, and by January 1st, 2014, it's going to be a completely different ballgame. So what should the American public do at this point? I mean, obviously educate themselves.
I think they need to vote in legislators. They're going to try to repeal this. We've got one more chance to try to do it. We need to try to repeal this. It's terrible.
41.
And how funny how Obama, this is supposed to be his marquee legislation. He doesn't even talk about it anymore. You know why? Because it's so unpopular.
Well, he's about to talk about it because they're putting $7 million, which I would rather see go into something more useful, into fighting back this smear from the right against Obamacare. We're going to be hearing a heck of a lot more
We don't
about
think
it.
it's a
right
smear.
now.
We think they're right.
Well, he
Let's
was
talk
out there
about the
yesterday.
four
He was out
tiers
there
of this,
yesterday
though.
talking about it.
The older people are going to be paying more. You're going to be rated on where you live, the number of people in your household, and also your tobacco use. Is that fair?
Doesn't that work on a normal insurance company that way?
Yeah, I mean, we have to have sensible policies. And right now we have insurance companies who are making money by not delivering services. Is that better than having the government have some kind of a general parameter for us to operate
It's
from?
not general parameter. I mean, this is socialized medicine. Is that the government telling you have to do this? I don't want to live in a country like that.
All right,
this
thank
is
you.
un-American.
Dr. Rossi, Jackie, and Dee Dee, we're going to come right back. Don't go away, everyone. We're going to change lanes and move over to the Big Apple and talk about some of the contenders. Does Anthony Weiner really have a chance of leading New York City? And what about Ray Kelly? Could he become the next leader of Homeland Security? We'll talk about that when Fresh Outlook returns.